Hello, good day to you. My name is Dr. Simon Wade. I'm known as the Webinar GP, and I'd like to invite you to attend the next CPD webinar for GPs and nurses on Wednesday, the 14th of January 2015. And the speaker is Dr. Stephanie deGiorgio, and the title of the topic is Perinatal Mental Illness, GP and Patient Perspectives. Now, you may not have been on one of the live and interactive web-based seminars, CPD and CME Made Easy from Webinars for GPs. I've been running live and interactive online CPD and CME webinars, web-based seminars since January 2013. We do them every week apart from Christmas and New Year. So I've just come back after a 2-week break, and we had a fantastic webinar last week on depression and how GPs can avoid burnout. And our next webinar is on perinatal mental illness. And as I say, Dr. Stephanie deGiorgio, who's a GP down in Kent, she's also a GP appraiser, and she's got a special ability and interest in discussing perinatal mental illness, because she's both a GP who's dealt with this many times, but also she's been a patient suffering with perinatal mental illness. And so she has a unique perspective. She's seen the good and the bad when it comes to GP care of perinatal mental health. And so she's passionate about wanting to help colleagues do a better job, frankly, do a better job in diagnosing and supporting patients with perinatal mental health issues. Stephanie is so passionate that she actually is a founding member of the Perinatal Mental Health Alliance, and she's part of the GP working group on perinatal mental health. And as I say, she's as well as being a GP, she's suffered perinatal mental illness herself. So really pleased to have her come on this live and interactive CPD CME webinar, and you can get your CPD updates online either watching the live webinar, or if you register you'll be able to get the recording and a link for that if life or work gets in the way of you attending the live one. So do register. The learning outcomes for this webinar, firstly, you'll be clear on the latest statistics regarding perinatal mental health problems and why diagnosis matters. You'll be clear on the symptoms and signs of perinatal mental health problems, because they're not always what we think. Thirdly, you'll understand and be clearer on how to provide the environment for a patient to divulge their symptoms. As human beings, we often put on a mask, don't we? We hide our true feelings with our facade. We put on a facade a bit like an actor. We put on a mask, but it's not seen as a mask, is it? You see somebody smiling, how are you? I'm fine. Unless we actually pause and sort of almost give people permission to tell us how they really are, we're not going to know. And that's key for one of the points that Stephanie's going to talk about providing the environment for a patient to divulge their symptoms. We're also going to learn, fourthly, about latest treatment guidance for perinatal mental illnesses and what to do, very importantly, what to do in the event of a perinatal mental health emergency. So if there's perinatal psychosis, what do we need to understand and be aware of so that we can manage that safely and effectively? Because there's obviously a significant morbidity, but sadly there's also mortality relating to mental ill health around the perinatal period. So I've mentioned about the learning outcomes. I've talked a little bit about Stephanie. I'm trying not to cough because I've had quite a nasty bug, and but I don't want any sympathy. No, no, I don't want any sympathy. Don't make me laugh. Laughter is good therapy, and even though this is a very serious topic, I'm sure you'll find the webinar enjoyable. And oh dear, I'm not sure what that sound effect was. I'm experimenting with some sound effects. Maybe I should stop experimenting and get on with saying, please do sign up and register for the webinar. Just for anybody who wants to get a deal on this, instead of the usual one-off £27 fee, there's a special promotion code that Stephanie has, and she will share that with colleagues so that you can register, put in the promotion code on the webinar payment page, and instead of £27, it'll be only £1. So I think that's pretty good, isn't it? Now, so the promotion code is secret, top secret. I can't tell you. Stephanie knows it. Talk to Stephanie, email her, Facebook message her, tweet her. She's very active on social media. She will share the promo code so that you can access for £1. So the clock is ticking. Do look forward to seeing you on the webinar next week. The days are counting down. Hopefully my voice will be a little bit better by then. And so I wish you a belated Happy New Year if I haven't already, and see you then. So remember, the clock's ticking. Get your registration in. Contact Stephanie if you want that promo code so you can attend for £1. And I don't know how many hours there are until the webinar. It's probably, what is it, 4 or 5 days? 4 days and counting. So I'll see you on the webinar. Thank you for bearing with me with these sound effects. Keep smiling, genuine smiling, keep laughing, and keep enjoying your CPD. Bye for now. I'll see you on the webinar, hopefully.